Hello, my name is Ashley. I'm from the emergency room. We're here with my friend, Miss Doubtfire.
My name is Edna, girl.
Girl, please. This is Edna. So what we're going to do today is talk about some emergencies that you may frequently see when you walk into your patient's room, kind of what those emergencies could be, what we need to do about those, who we report them to, and what we're going to anticipate once we do report those to the nurse.
That sounds good.
You okay with that?
That sounds real good.
Okay.
We're gonna talk now.
Miss Edna, can you tell me your name and date of birth?
Edna Brown.
When's your birthday?
I don't tell the people the year, but January the 10th. I can't tell you the year. I have to kill you.
All right. So
All
we're
right.
going to check Miss Edna's armband. We're going to make sure that's her name and date of birth. And we're going to say that I'm coming in.
It's a secret.
Oh, that's her. That's her, Miss Edna. That's you. All right. I'm coming in to take Miss Edna's vital signs. And I notice when I come in and I go to tap her here, she's not responding to me as much as she was the last time I came through. I noticed also that when I touch her skin here, it's kind of cold and clammy, and she feels like she's sweating. Miss Edna, are you hot?
Girl, I'm always hot, girl. Let me gotta take these covers off. I'm always hot, girl.
I heard that about you, Miss Edna. All right, so I noticed when I come in here, I also know that Miss Edna's a diabetic, so I'm a little concerned that possibly her blood sugar's low. She's cold and clammy.
Girl, don't let my grandchildren hear you tell them I'm a diabetic. They won't give me that kick.
So the first thing we're going to do is I'm going to go out and get some help. Jackie, can you come help me?
Jackie?
Yes. Hi, Miss Edna.
Hey,
Do
Jackie.
you remember me?
Yeah, I know you.
Okay, I'm going to check your sugar, okay?
Okay.
And make sure, let me double check your armband and make sure you're the patient.
Don't be looking at my birthday.
Okay.
Okay.
Miss
Come on.
Edna Brown?
Come on, hurry up now. My
Okay.
story coming on.
Come on, Miss Edna.
Hurry up.
All right. You check
Why
your
she
sugar.
checking my blood sugar? Because I'm clammy?
Yes,
Yeah, Miss Edna, we're a little worried. Your sugar
There
may
we
be going to
We're
drop.
going to check your
But-
sugar.
Okay, you got to have an order for this?
Oh,
Okay.
no, we're good. We done talked to the doctor.
Miss Edna, your sugar is low. I got to go. I'm going
That's
to tell
that
the
Dr.
nurse.
Ramsey, ain't it?
That Dr. Ramsey, yes. But your sugar is low. I got to go get you some orange juice. And let the nurse know, and so we
It's
can
okay,
call the
Miss Edna.
doctor.
We're going to take good care of you. We're going to call the doctor, okay?
I'm going to just pass out.
Oh, it's okay. I'm going to be right here with you.
Some orange juice, okay, Miss
Jackie, can you
Edna?
go have them page the doctor for me?
All right.
Just grab her a little bit of orange juice in the
Okay.
meantime, okay? Thank you.
All right, now. Okay.
You're good, Miss Edna. We're going to take good care of you,
All
okay?
right. Well,
All right.
Emergencies. Is there any other emergency? I don't like this emergency.
You want a different emergency?
I don't want to be a
All right,
diabetic.
let's talk about a different emergency.
Okay.
All
I
right.
promise to be your model, but I'm not going to be no diabetic.
Miss Edna, I got your orange juice. We're going to need you
We
to
quit with that one. We on to another one, baby.
No,
We're
baby.
going to another emergency.
No, we're
We
going to
done-
drink this orange juice.
Tell
Miss
her
Edna.
we done with this
we got
emergency.
a new emergency
We got a
now.
new emergency.
I'll call you whenever
Oh,
you
now
want.
Okay.
keep up with the script, girl.
Oh, okay.
Keep up with the script.
All right, so one of the other emergencies that we can see is, as you guys know, our hospital is in the process of becoming a primary stroke center. Let's say that I come in, it's 3 o'clock in the morning. I've been with Miss Edna most of the shift now. She calls me, she hits the call bell, and she says, I just don't feel good. I walk in the room, and when I get here to see Miss Edna, I notice that she has some facial drooping. She hasn't had this prior to me being in here, so I'm going to come in and I'm going to say, Miss Edna, tell me where you are right now.
I'm in Beaufort, the Memorial Hospital.
Yes, you are. Miss Edna, I want you to squeeze my fingers for me real quick. Squeeze, squeeze, squeeze. Good job. Smile. You got your teeth in, Miss Edna?
I got them in, girl.
Okay. We got to be in here with our teeth in.
Got 'em.
Never know who's coming to visit.
Girl, they say y'all are still your dentures, so I'm going to keep them in. I'm going to keep them in.
We're trying to work on that. You should keep them
yeah.
in. So I noticed when I come in that she has
I
some
don't know who
facial
can wear your
drooping.
denture. Why would I steal your dentures? Go
Got
ahead.
facial drooping.
Oh, girl, I got this worked on about 20 years ago. Ain't no way that's drooping.
It's drooping, Edna. When
Call
she
the
goes
doc-
to
call
smile,
the
I
plastic
notice that
surgeon,
there's
Jackie.
drooping there.
Call the plastic surgeon.
So one of the first things we're going to do is we're not going to call the plastic surgeon, Jackie. I need you to go call the physician, let him know.
I will.
Grab the charge nurse for me.
Okay, I sure
So
will.
the nurse is going to come in and we're going to anticipate the fact that this patient may be having a stroke alert. As you know, with our stroke alerts, we have a whole process in place where we can call a stroke alert. We're going to call it overhead. The ER team and the stroke alert team are going to come up with the telemedicine cart, and we'll be able to do a complete neurology consult at 3 o'clock in the morning with the neurologist from MUSC. Who's Anytime, baby. Miss Edna, we got you covered.
I'm listening.
Now keep them teeth in, because we got to be pretty when we get there. So they're going to come in and do a video, ask her different questions, ask her to follow some commands, and determine if she is in fact having a stroke. If so, we'll
Ain't having no strokes.
one of the first things that he's
That's
going to
worse
ask
than the
you.
diabetes.
one of the first things that he's going to ask you, and one of the people who's going to know this answer best is the CNA who's been in a room. So he's going to say, what's the last known well time? He's going to ask me as the CNA or ask me as the nurse, when did you last see Miss Edna well? Well, I can look at my rounding sheet and know that I came in at 3 a.m. to help her to the bathroom and because she said she wasn't feeling well. But I was also in here.
You did your rounds.
I wasn't here when I did my hourly rounding at 2 o'clock, and she was sleeping and didn't appear to have anything going on. But I did wake her up and ask her if I could do anything for her, and she did not have the facial drooping at that time.
I asked you to take my jewelry off, but you didn't.
Girl, you worried about me stealing your teeth? Your jewelry's gonna be gone too.
Girl, that's cheap. Okay, go ahead.
All right, let's talk about a different emergency. You done got lipstick on my sheet.
Oh, girl, I was out.
That's why her face is drooping. Who you been kissing?
Just me. Cardiac.
Let's talk about, that's a good one, Jackie. Let's talk about what happens to your patient when you come in the room and they're clutching the chest. Clutch your chest, Miss Edna. Elizabeth, I'm coming to you. That chest. That chest. So we come into the room and she says she's having chest pain. Some of the first things that we're going to look for when we see that she's having chest pain is we're going to, again, look and see if she's cool and clammy like we talked about with the diabetes. We're going to look and see if she's already on oxygen. Obviously, any patient that has a new onset of chest pain, first thing I'm going to want to go do is let the nurse know, hey, the patient in room 5 is having chest pain.
Please tell the nurse.
Please tell the nurse. Tell the nurse we have chest pain.
Please tell the nurse, because I'm in trouble.
Okay.
So we're gonna anticipate orders possibly for an EKG. We're gonna anticipate possibly putting this patient on oxygen. We're gonna call the hospitalist who's attending to this patient, have them come down and see the patient. We would anticipate they may need our help in drawing labs. We're gonna check her cardiac enzymes. Have them look at the EKG and see if there's any changes. Another thing they may ask you to do as a CNA.
I went to the gym. That's one thing I did. That could be causing okay.
Absolutely, that's what happens when you exercise.
That Kim had me squatting.
You did go to the gym
She
with
had me
Kim
squatting.
yesterday. That's right. That's right. So we can anticipate possibly needing to pull our EKG from yesterday morning so that when the cardiologist gets here or when the hospitalist gets here, he can compare yesterday's EKG with the stat EKG that we just took now and see if we notice a difference between the two.
All right. That was good.
That is good, Miss Eddie. You want to talk about any other emergencies?
I don't want nothing else.
You good now?
I think I'm pretty much done for. I
You're
got to get out of this hospital.
Now, we're going to be calling you to see if you had
I think
excellent
I'm
care.
done.
I need you to tell them you had excellent care.
Y'all
Miss
gonna
Edna.
call?
We
That's
gonna call.
important.
That's important.
Because y'all did your rounds and
Yes,
all of that.
we did.
And knowing I had a
Every
problem. And Jackie gave me orange juice.
And we didn't steal your teeth.
You really still your denture. And you still got the jewelry.
And I still got my jewelry.
She still got it, girl.
Thank you.
All right, Miss Edna. Bye now.
Bye.
Bye, Miss Edna.
Bye.